Hello all, this is Shambhu Rawal. Today I am going to present my slides that focus on my project overview and outline. This presentation is for my assignment on UMGC Data 670 Data Analytic course for the 2022 spring semester. As we all are suffering from COVID, I'll discuss about on the effectiveness of COVID vaccine towards the new COVID cases and deaths in US states. COVID-19 is a type of virus called SARS-CoV-2. COVID may affect the lungs and the respiratory system. Older people and people living with medical conditions are most affected and become serious by COVID. Anyone can get COVID and may become seriously ill or die. It transmits easily from person to person and the virus spreads massively. The COVID affected every sector in the world: hotel and restaurant, tourism and transportation, banking and financial, health sector, education, retail, and job market are mainly affected by the COVID. People lost their lives and jobs. The COVID impacted business and economic crisis induced. COVID impacts people and leads them to depression, anxiety, loneliness, and post traumatic stress. The very contagious and quickly transmitted nature of the virus spread all over the world. COVID pandemic has affected many people's lives and their economies. In other words, the COVID induced recession in the world. The WHO has recognized below variants as variants of concern. There are many variants of COVID, but I'm discussing only about the variants of concerns that WHO recognized. Alpha is the one of the variants that is sold in United Kingdom in September 2020. The beta variants first time sold in South Africa in May 2020. The gamma variants also sold in Brazil in November 2020. The Delta variants first time sold in India in October 2020. The Omicron variants appeared in multiple countries in the same time in November 2021. In this slide, I'm discussing about symptoms and preventions of COVID. People may have different symptoms. It is different based on person's body. People may get fever and chills. They may also get fatigue, headache. They may also have sore throat or coughs. People may get shortness of breath or difficult breathing. They may also have problem or nausea or vomiting, body muscles and aches. They may also get diarrhea, runny nose. They may also loss of taste or smell. We tried our best to prevent from the COVID. Wash our hands regularly. Use sanitizer. Wear face mask when needed. If we need to cough, we can use tissue or our own elbow. Practice social distancing is one of the good approach to prevent from COVID. CDC also provided the guideline about this. Stay at least 6 feet away from the other people. Avoid close contact with the COVID sick people. Depending on COVID variants, we need to quarantine 5 to 14 days after the travel, or if we feel we were close contact of someone who had COVID. If we have a COVID, or if we think we have a COVID, we should have to test for the COVID. Now, currently, we have there are vaccines available. We can get a COVID if possible fully vaccinate. I'm discussing about the COVID statistics, US unemployment rate, and COVID vaccine in this slide. The first COVID case was reported on December 1, 2019 in Wuhan, China. The first COVID cases in USA was identified in Washington state in January 18, 2020. Per worldometer as of February 5, 2022, there are 393.52 million total cases in global, 77.61 million people cases in USA, 5.75 million people died from the COVID in globally, 925,000 people died in USA because of COVID. There are 312.42 million people recovered from the COVID globally. 47.67 million people recovered from the COVID in USA. There are still 75.35 million people are affected from COVID. In the USA, 29.01 million people have COVID in USA. The US Bureau of Labor Statistics showed as of January 2022, 6.5 million people are unemployed. 2.3 million people claimed unemployment insurance. The US unemployment rate was 4% in January 2022. The COVID vaccine is one of the main tools that help to stop coronavirus disease. The COVID vaccine is a game changer that mitigates and improves socio-economic and health status. It reduces the risk of getting COVID, protects against severe illness, and spreads the COVID disease. The COVID-19 vaccine was released in December 2020. There are few vaccines. Pfizer, Moderna, Johnson and Johnson are the major vaccine in USA. Pfizer and Moderna have two doses, and Johnson and Johnson has one dose, and there is another booster dose available for all vaccines. Per CDC as of February 5, 2022, 212.7 million people fully vaccinated in USA. That means they got both doses of Pfizer or Moderna vaccine or one dose of Johnson and Johnson. 250.92 million people in USA got at least one dose of vaccine. 89.59 million people got booster dose in USA. For our world in data, as of February 5, 2022, 61.3% people in all over the world got at least one dose of COVID vaccine. Objective: the purpose of this report is to analyze the effectiveness of COVID vaccines towards the new cases and deaths in US state. The objective, the first objective of this project is to identify the best worst US state based on vaccine effectiveness. Based on this report, concerned stakeholder can build, modify the plan, focus, and allocate the resource accordingly. Resources can be mobilized to raise awareness and motivate them to COVID vaccine. Decision makers can make the proper decision and help the government complete the vaccination campaign. The another objective of this project is to identify the best worst US state based on unemployment rate. The US state unemployment rate is also directly impacted by COVID. The main goal of this project is to predict the new COVID cases and deaths to vaccination numbers. The project will also help predict the US state unemployment rate. People lost their jobs during the pandemic. The report will help the public private sector to plan or improve or modify their strategy based on the result. They can focus on best worst US states and implement, drop, hold, or hold their project ideas. Corporate offices, businesses can create more job opportunities. The another objective of this report is to analyze the best worst US states based on COVID new cases and deaths. Individuals will be motivated to return to a normal life. Individuals can make or drop their travel plans and other business plans. People will also be motivated to get a job that will reduce the unemployment rate. If there is any other reason for fewer people being vaccinated, decision makers can make the proper decision and help the government complete the vaccination campaign. Based on new COVID cases, deaths, and unemployment rates, stakeholders can choose the best approach to improve the current status. Stakeholders, government, federal agencies. Government builds, modify the plan and focus on the state that is less vaccinated. They can analyze and identify the reason for less vaccination. They can raise awareness to improve the vaccination rate, and if needed, it can allocate the resource accordingly. The US unemployment rate and COVID rate and COVID's impact on the job market are also analyzed in the report. This will help to government to focus on improving the unemployment rate in the specific states that have higher unemployment rates. Private public sector. Public private sector improve or modify their strategy. They can focus on best or worst US states and implement, drop, or hold their project ideas. They can support the government and people to control the COVID. If needed, they can also provide medical supplies and mobilize their resources and support the government to stop spreading the COVID. They can modify their business plan and changes or updates their hiring plan. The another stakeholder of this report is people. Individuals can plan or drop or their plan travel plans or business plan to those states. Individuals get motivated to return to a normal life. Based on this result, people will also be motivated to get a job that will reduce the unemployment rate. If the COVID vaccine effectiveness effectively work and COVID cases decrease, there will be more job opportunities in the market. What others have done? The model predicted that COVID will not be eliminated from the US by 2022, but it will be in the process for normal social distancing behavior. In the article, we predicted the vaccine's effectiveness in minimizing COVID. The article predicted daily COVID cases to be dropped on a very low level by January 1, 2022. In the another article, Stein and Worth says COVID deaths will fall to 100 a day and new infections will fall to about 9,000 a day by March 2022. In this article, four different potential scenarios regarding childhood vaccination and new vaccinations are discussed and analyzed. There are many other analyses, but I took the above two of them. I will analyze the US state unemployment rate before the COVID vaccine and after the COVID vaccine in this report. More than 80% of the people will be vaccinated by June 2022. That's my prediction. Another prediction I have is the new cases will drop to 3,000 per month by June 2022. And I have also predicted the death rate will be less than 500 per month by June 2022. KPIs. Indicator 1. The first indicator I have is number of new COVID cases before and after the COVID vaccine. New cases will drop to 3,000 per month by June 2022 in the US. I also believe more than 80% of people will be vaccinated by June 2022. Government, private, public sector, and community will mobilize their resources to complete the vaccine campaign. With the help of COVID vaccine, it will help to stop or control the COVID transmission rate. If the new COVID case drop, people don't need to practice social distancing. If the new variant does not come, then we will win the COVID soon. The new COVID cases before and after the COVID vaccine in the US by state will be compared on this section. The another indicator I have is number of deaths due to COVID before and after the COVID vaccine. The death rate will be less than 500 per month by June 2022. That's my assumption. I also believe that we will see that US states have fewer death rates where people are vaccinated. As I mentioned in the above indicator, the COVID new cases will drop. The dropping of new cases will have a positive impact on the death rate. The death rate will also decrease. It will motivate people to vaccinate. more people will receive the vaccine. The death rate before and after the COVID vaccine in the US state will be compared. The another indicator I have is unemployment rate before and after the COVID vaccine. After observing the COVID vaccine's effectiveness, the employers announce says the job opportunities based on their plan. The unemployment rate will drop to the normal rate that was before COVID. People lost their job or left job due to COVID. After the COVID vaccine, there is hope. There are more openings in the market. People are willing to go to the on-site job. The last indicator I have is the predictive model will show the COVID vaccine's effectiveness towards new cases and deaths. It will predict a decrease in new cases and deaths. It will also predict a drop in the unemployment rate. The SAS enterprise miner and Tableau predictive model will be able to have 80% of model accuracy. I will use the SAS enterprise miner and Tableau to predict the to predict this. The Tableau desktop will be used to show all the indicators in the chart. Here is the project milestones. Identify the data set based on the study objective. I analyzed the project scope. Currently, I'm identifying the tables and variables. This is the current stage of my project. I will do exploratory analysis with the help of Tableau Prep. I will use predictive. I will use Tableau Desktop and SAS Enterprise for the predictive model analysis, and then I will enhance the model to improve the accuracy. And finally, I will complete the final report. Here's the high level of data diagram that I'm using. I'll use I have used three different data sets have been used for this project. The US state COVID vaccine data is used as a primary data set. It is available in GitHub that retrieves data from the our world in data. The data tracks the vaccination campaign in the US and it relies the CDC track. The COVID cases and deaths data. The COVID cases and deaths data by US state have been used as a secondary data set that is available on the Centers for Disease Control and Prevention CDC website. Both data set gets updated daily. The other secondary data set is published by the US Bureau of Labor Statistics that includes unemployment rates by state. So these three data sets will be merged, will be combined with the help of Tableau Prep. I will create a master data set in Tableau Prep where I will perform the ETL, data preparation, data cleaning, and cleansing and blending process will be there, held there. I will use that master file to in Tableau desktop to prepare the visualization and analysis. I'll use the data set, master data set in SAS to do predictive modeling analyzing. I will compare. I'll do the predictive modeling in Tableau and SAS to compare with each other. This is my high-level data diagram. The US state COVID-19 vaccine data is the my primary data set, which is available in GitHub that retrieves from our world in data. The Edward Matthew is the dataset owner. The dataset is issued on January 16, 2021, which updates daily at 8 p.m. It tracks the vaccination campaign in the US and relies on CDC data. It has 65 locations of the data. There are 16 variables, one date, one text, and 14 numeric types of variables. It has 25,252 rows of the data. It captures the vaccine information from December 20, 2020 to February 5, 2022. There are some outliers. There are 13 federal entity and locations which I will exclude from the analysis because I'm comparing only states in this analysis. The another data I will use is the COVID-19 cases and deaths by state over time, which is secondary data set. It has 15 variables, 2 dates, 3 text, and 10 numeric variables, and it has 44,700 records of the data. It's available on CDC website. It is provided by CDC case task force. The data was issued in June 11, 2020. It updates twice daily. The data captures case number of cases and deaths in US states between January 22, 2022 20 to February 5, 2022. It also has eight US states and in US state territories and institutions information, which I will exclude from this analysis. The another secondary data set I will use as in the analysis is US state unemployment data, which is published by US Bureau of Labor Statistics, which has 124 attributes. Data definition. The US state COVID vaccine data has 25,252 rows of the data. It has 16 variables, one date, one text, and 14 numbers. Here is the details of these variables. I have a data type. What are the data types? I have the description of these variables. The second data set I use COVID-19 cases and deaths by state over time. It has 15 variables, 2 dates, 3 text, categorical, and 10 numeric variables. It has 44,700 rows of records. Um, Here I have data types, definition of these variables, and then similarly I have used another secondary data set called US state unemployment data. It has 124 variables, attributes, one text, and 123 are numerics. It has 52 rows of the data. First variable is state, and then all other variables are belongs to months and years, which covers November 2011 to December 2021. Here is the references for my project. um, this is the reference I have taken for this analysis. Thank you for your time. Thank you.